So, good evening friends. Uh, Today we discuss regarding use different instrument of rhinoplasty. I have a lot of query regarding my beginners and junior colleagues. They want then which instrument usually we purchase and which instrument usually we use, and because when you start the career then you need the good instrument. So today basically we discuss regarding the use different type of the instruments that usually we use in the rhinoplasty. So we can categorize these instrument either I think one is a basic category and one is the advanced instruments. So I think when you start your rhinoplasty career, because all instruments are so expensive, so first you start and you purchase the basic instruments. So by which you comfortable open your nose, close your nose, you can do the osteotomies. So first we discuss regarding the use the basic instrument and then we discuss some advanced instruments. So look that in the front layer we have the basic instruments, all basic instruments, like after the infiltration when we open the nose, then we need some like the scalpel, scissor, elevator, hooks and the nasal speculums. So we usually use all these instruments. So look that after making the incision, after making the transcolumella incision, we use these hooks that usually we need. So in the rhinoplasty routinely we need these four types of the hook. This is the single hook that after the transcolumella incision we just use like this, and another is the wide double prong. This is wide double prong retractor. So this wide double prong retractor used for the counter tractions like this in the soft tissue for the lift up the soft tissue envelope and like this transcolumella skin. So you need these two, one is the small one and then bigger one, and this basically LR retractor that we usually use for the lifting the soft tissue envelope. And this instrument is a good instrument. We also use when you make the infiltration like the for the marginal incision, then for eversion, like for eversion of the columella, for the lifting of the margin of the ala margin, we usually use this instrument for local infiltration along the marginal incision. So these usually hook usually we need for the exposure, and then after exposure for lifting the soft tissue envelope for the lateral crust, we usually use this Kakir periosteum elevator. This is a type of elevator. So just we hug by this instrument and then we just expose the on both sides of the lateral crust. One side of this instrument is sharp and another that is little bit blunt, but it's a good instrument, and you can lift up the soft tissue envelope from the mid vault, from upper lateral cartilage, also from the basically the nasal bony pyramid also. And this is the instrument you can buy from the Marina Medicals. This is the from the Marina Medicals. I bought this instrument from the Bergamo in Bergamo course, but you can find in the Marina Medical. Now other instrument, then when we lift up the soft tissue envelope from the bony vault, then this is the Joseph periosteum elevator. So the beauty of this instrument, after making the incision in the periosteum, just you can pass and then you lift up the periosteum on the lateral nasal wall and on the top of the dorsum. So Joseph periosteum elevator we usually use for lift up the periosteum for just for the subperiosteal dissection. So this is the Joseph periosteum elevator. And another important thing that usually we need for after the incision for lift up the flap, I love this scissor. This is a good scissor from the Marina Medical. So this scissor have the good angle, so just we spread it and cut, because this is the angled and the sharp scissor. So these usually 2 or 3 good scissors you need. This is again the scissor by the angled scissor by the Marina Medicals. So when you dissect the angle, then you can use. But I love this scissor. I think you should have this scissor. This is a good scissor. You can use this scissor as a periostem elevator like this, like so many my fellows use usually, just like a pen holding position. So you can use as a periostem elevator, you can use as a cutting scissor, so it's a good scissor. So I think you have this 2 or 3 scissors you basically need for the lift up the soft tissue envelope. Now after lift up the soft tissue envelope, after making the transcolumella and the marginal incision, then for septum exposure you need these suctions and periostem elevators. I usually use first these forceps because usually we have the Edson Brown forceps, but in the rhinoplasty for the cartilage holding you need this good cartilage holding forceps. You can find this is also I got from the Marina Medicals, and you find the Medicon also. This is a good, so they have a good serrations on the top of this one. So when you hold the cartilage, then they have a good grip. Otherwise the simple Edson forceps they cut the tissues. So these are the 2 cartilage holding forceps. This is a good cartilage for holding forceps. And then we have a different type of the periostem elevator, like the Freer's elevator. Okay, Freer's bhi hoga na, Freer's elevators and different type of the elevator. But we usually use, I think everyone, these 2 instrument that usually we for this instrument. This is the periostem elevator from the stores. Yes, this is the Freer's elevator. So the beauty of this instrument, look that one side is so sharp and another side is the blunt. So after exposure, the mucopericondium flap at the anterior septal angle area, you just scrape by this sharp end and just to find getting the plane, just to find the plane. So you can find the plane by this sharp end of the instrument, and you can find the plane by this sharp scissor also. Once you get the plane, then the another blunt end, then you can use for the lift up of the mucopericondium flap from the cartilage part and then bony part. And suppose if you don't have this instrument, then you can use this Freer's elevator for the same purpose like everyone you use for the septoplasty. And another instrument, this instrument I think everyone you have, and if you don't have, then you can buy this instrument. This is the suction periostem elevator. So mostly ENT guys, I think you have, but I think the plastic colleagues I doubt that they have or not. So the advantage of this, that the both the suction and the periostem elevator both by this one. So we can use for the mucopericondium deglobing of the septum. Now after the exposure of the septum for the septoplasty, we use this instrument again when we deattach the attachment between the PP plate and the perpendicular plate and the septal cartilage. So look that this end is very useful, because you can just by this section you can break the junction between the PPE plate and the septal cartilage. So this is very good instrument for this one. And now after septoplasty, then I think everyone have used this instrument. This is the turbinate scissor and nasal speculum forceps, and this is lux forceps. These are the routine instrument. Then after the septum exposure, these instruments are usually used for the bony pyramid modifications for the osteotomies. So for the osteotomies we use different type of the osteotomes, and we also use different type of the like powered instrument also, and we also use the like the Piaggio, and sometimes we use these different type of the burr also. So first we discuss regarding the osteotomes, because for the lateral or paramedian osteotomy we have this different type of the osteotome. So first, for the paramedian osteotomy, we usually use this Medicone instrument, 3 mm osteotomes for the paramedian osteotomy. So I think you everyone you have, this is the basic instrument for the paramedian osteotomy. This is the straight for the superior oblique manner you need for the paramedian osteotomy. Then now for the lateral osteotomy, again we need the osteotome. So for the lateral osteotomy, if you want to go the internal continuous manner, if you want to go the internal continuous manner, then for the internal continuous manner you need these osteotomes. So we have these two types of the osteotomes for the internal continuous osteotomy. One is the curved osteotome, okay, and another is the straight osteotome. When you use this straight osteotome, then this straight osteotome, the advantage of this straight osteotome, then by this one osteotome you can do the osteotomy on either side, either the left side or either the right side. But the important thing when you engage that, look that one is the guarding end and this is the cutting end. So the important thing for my junior colleagues, then when you engage the, look that if suppose this is the lateral nasal wall, then when you engage it at the lowermost part of the piriform aperture, or according to your pattern of osteotomy, either the high or low to low, you engage like this. So this cutting end, that is the inside, and the guarding end is the outside. Okay, so when you use the left side, then you use like this, and when you use the right side, then you use like this. So this is the advantage of the this straight. Now they are the curved osteotome. When you use the curved osteotome for the internal continuous lateral osteotomy, then you use the right or left side different, and on both this curved osteotome, then on either side, outside we have this guarding end and this is the cutting end. So advantage of this, when you use this guarding end, then throughout the osteotomy you can feel where you are working, throughout where you are working. And sometimes it help also when, because when you patient have a thick bone, then sometimes the osteotome is displaced. So if you put the pressure by a thumb outside on lateral nasal wall, then it prevent the slippage of your osteotome. So you use either the right side and the left side according to the this guarding end. So guarding end outside and the cutting end inside. So these are the osteotome that usually they are osteotome are the Medicone instrument. They have the good quality osteotome, and I think you should have the good quality osteotome, because otherwise you lot of the struggle. You need the good osteotome. Suppose if you go the lateral osteotomy by the external perforating manner, by the multiple perforations, when you go for the external perforating osteotomy, then you use this Medicone 2 mm osteotome. This is the 2 mm osteotome. So we just use this osteotome just like this 70-degree position, and just on this lateral nasal wall, first we mark in the nasofacial groove, and then after the marking just we hold at the 70-degree and do the multiple perforation. And when we do the multiple perforation, then the ideal, the distance between the two perforation is not more than 2 mm. So it help in the green stick fracture. So these usually use osteotome. Then we for the mobilization of the lateral nasal wall, I have this one more instrument. This is the bone mobilizer. Then this the beauty of this instrument, that look that this is very blunt. So after the osteotomy, when we mobilize this bone, there is no trauma inside of the nose. So you can mobilize the bone outside or the inside. So this is the very good instrument, bone mobilizer. So these are the instrument usually used for osteotomy. Suppose sometimes your patient have a bump on the nose, then this is again a basic instrument for the rasp of the hump and for refine of the nasal bone. So again this is the instrument from the Medicon company. You can buy, this is the beauty of this one, that on both sides you have the different number of this blade for the rasp. So this is the key of this one. So suppose your these blade are blunt, then you can change this and you can purchase the new blades and then you can replace it. This is the advantage of this one. So you can detach it, and once it blunt, then you can change it. So no need to the change the entire instrument. This is the beauty of this instrument. So when you purchase this instrument, then you always ask to the medical person, then you need this key, otherwise it's very difficult to remove it. So this is the basic instrument after the osteotome for rasping. And then these are the basic instrument that usually we use. Now we have some other basic instrument also, my friend. We have these three board. This is the wide board, silicone board of by the Medicon company. So when you make the diast cartilage, then this is the good, because they have a border, so the diast cartilage is not slipped, and once you make good diast, then this is the advantage, because in this this board have a slot for this insulin syringe. So if suppose this is your insulin syringe, then how you fill it, because it's very difficult after making to put inside of this insulin syringe. So just like you just in this slot you pass this one, and then you can just by this some instrument you just fill this one. So it's very easy, it make very easy. Otherwise it's very difficult, because after making the diast, it's very difficult to put inside. So I think you should have this, you buy, because this is the one time investment, you purchase this one. And then another we have this another sheet by the Medicon. So this is the for making the slice of the cartilage, and look that the measurement, if this is a 0.5 mm, 1 mm, 1.5 mm, 2 mm. If you have a big block of the cartilage, then if you want to make a 0.5 slice, then just we put it and by the knife we cut it. So this is the advantage of this instrument. And then again this is another instrument, and just for making the different type of the graft, like the septal extension graft, like the spreader graft, because we need the ideal length of that graft. So look that this have a measuring, this have a marker on this side. So you can make easily according to your ideal width and the length. So you can make the ideal dimension of your graft. So these three, I think you should have. These are the basic instrument, like the seizures, like the osteotomes, like the rasping for the hump rasper, and these blocks are the basic. And these forceps, these are the basic instruments, and I think for the septoplasty you have the basic instrument. Now we have some advanced instruments. Once you do the more and more surgery, once you become the good rhinoplasty surgeons, once your practice is increased, then you have some more advanced instrument. I have this one more good instrument. This is the instrument that is the lateral crura retractor. This is the lateral crura retractor. Look that on this lateral, because usually we just retract the lateral crura by the mosquito forceps, and sometimes we struggle. So the advantage of this one, just you can pass like this, and this weight have the advantage just for the retractions. So they both lateral crura retractor, then we can use like this. So this device is by the Najim Circus, and I think that by the Marina Medical. So if you find the Marina Medical, then you can find this instrument, lateral crura retractor. And then another one good instrument we have this, because usually when we lift up the soft tissue envelope, then one person always hold by operates retractor, and so it's very difficult to hold. So this instrument, by just you pass like this, and then we just pass in a slot by this towel, and then continuous self retaining hold the soft tissue envelope in on whatever you need according to the good exposure. So these are the good instrument for exposure of the soft tissue envelope. This instrument, again, this is the operates retractor just for the same, but the disadvantage of this instrument, then you need to hold this instrument. But sometimes when you lift up the soft tissue envelope after the mid vault on the dorsum of the bony vault, then this is the good instrument. And another advantage of this instrument, look that in this instrument you have a slot. So sometimes if you need the partial augmentation, then just you fill the diast cartilage on this part and you put the glue, and then slowly just you pass this and you leave it. So just for the making a diast cartilage for the augmentation also you can use this one. We have this other instrument also, friends. So these two instrument, look that this instrument, this is a very good instrument. I think this is the Medicon instrument. So the instrument for the rib, when you harvest the rib graft, then the most difficult aspect, because when you making the when you go the sub perichondrial, then on inferior surface of the rib, the beauty of this, after getting the plane, if you pass this instrument like this and then you scrape like this, then it's very easily you can lift up the periosteum perichondrium on under surface of the rib. And we have this is two, either from the right side and from the left side. Otherwise we have the lot of struggle after getting the plane also to separate the mucoperichondrium from the rib. So both sides, from the right side and from the left side. So I think this is also the basic instrument, because when you have the augmentation rhinoplasty, then definitely you need the rib. So you purchase this rib periosteum elevator. You can ask to the Medicon persons the rib periosteum elevator. And another instrument we have this one, just small syringe by the Medicon for sometimes just to camouflage some minor irregularities, and when you have a some fine diast cartilage, so you fill it and then just make a where you have a like if you need sometimes in the radix area, then you just can fill. So the same work of this insulin syringe, but this is the too big. Sometimes when after putting the big dorsal graft, it's very difficult to negotiate this insulin syringe, so you can use this small cartilage plunger. And now we have the other instrument. Yeah, we have this one instrument also. This is the rib cartilage holding forceps. So look that the beauty of this, then you can hold it very easily. So this have the multiple serrations. So because sometimes otherwise the rib, that is the slipped. So the advantage of this one, that you can hold very easily. Again, this is the by the Marina Medicals. You can find the Marina Medicals rib holding forceps. So it's a very good, because sometimes you make the slice like by this blade, then it's very useful for making the slice. And this instrument, this is I think this is a good instrument. This is the cartilage crusher. So for the cartilage crusher, if you need the crust cartilage, then just put the cartilage part on in this, and then by the hammer nail hai, by the hammer just you put like this, and then according to the tighter of the pressure, just by the tighter of the pressure, and then you can crush the cartilage and you can morselize. So then sometimes when you use some graft just for camouflage the defect, or sometimes you just use the small piece of the graft for the cap graft for the undersurface of the lateral crust deformity. So this is a good instrument. You can purchase, this is the Kalilkar also, this is the not too much costly, you can use by the Kalilkar also. And we have this is another one, this is the this again, this is by the Marina Medical, by the Najim Circus, and this is the bone cutter basically. Sometimes if you have a at the time of the osteotomy, if you find that your dorsum is too wide and you want to the osteotomy and you want to the some cut the bone piece, then you cut this by the this is a very good instrument for the cutting the bone. Again we have, this is the profilometer. This instrument, both instrument just for measuring I think the length of the nose and just for the height of the nose. So during the pre-operative analysis I think you need this for measuring the length and height of the nose. And again this is also the profilometer. So this instrument use just for like the already present the projections in the tip in the mid wall, and then after your target your desired projections, then you can measure. So this instrument just you put on the glabella, and we just show in the live cases. So this is a good instrument, because if you want to exact precise projections, because sometimes my junior colleague asked how can we get the exact precise, because this instrument usually used by Dr. Vitali, and he uses very precisely. So you can just pre-operative you measure your projections, and then post-operative after your measure the graft, then you can check whatever amount of your projections you can increase or decrease. So this instrument used for that. Again this instrument you use for the lateral crura measurement. Sometimes when we excise the wide part of the lateral crust for the cephalic trimming, so how much you excise, so we decide by this instrument how much we preserve. We just look that in this we can measure either the 8 mm or 10 mm. So ideally we should preserve around, in Indian skin thick skin patient, 8 to 10 mm. So we just measure it, and just by the betadine or something you can measure just like this, and then rest of we excise. So this is the good instrument for the lateral crura excision. Again this is the instrument for the measurement of the angles, pre-operative and the post-operative, for the nasolabial angle measurement and for the nasofrontal angle measurement. So this is the good instrument. So these are some advanced instrument, then you can purchase later once you start the practice. And another a lot of query by my bigger friends, then usually we use different type of the sutures. So they are the fixed sutures that usually we use in the rhinoplasty. This is the 6O vicryl rapid. This is the 6O vicryl rapid. So this 6O vicryl rapid usually we use for closing the transcolumella and the marginal incision. This is the 6O vicryl rapid, and this is the awesome suture. You don't have any scar, and after the 10 day when your patient comes, then you can't find any scar. So the 6O vicryl rapid suture usually you can use for the closing of the incision. And then this is the 4O vicryl, that 3 or 4O I think everyone you use. I usually use this suture for the quilting sutures. So just to decrease the dead space between the two flaps, so I usually use the 4O vicryl sutures, and then we use this 4O and the 5O PDS. So remember, wherever you fix any structure in the rhinoplasty, like the spreader graft and like the when you use like the septal extension graft, then I usually use the 4O PDS suture. This is the 4O PDS suture in the 4O PDS suture in the cutting needle, and another is the 5O PDS suture. So these 4O and 5O suture usually use 5O suture for like the dome creating sutures, for the interdomal suture, for the Torumi oblique sutures. A different type of the sutures we use the 5O, and for the fixation of the any graft you use this 4O PDS sutures. And this is the 5O proline, that 5O proline usually, this is the 5O proline that usually used for the just after the ala base excision, for the closing the ala base excision. This is the 4O, but I usually use the 5O proline sutures, and I usually remove when remove my plaster. I have one or two good instrument also. This is also the suction periosteum elevator. After the evolving of the preservation rhinoplasty, such type of the instrument is very useful, because sometimes when you have a big bump and you use for the rhinosculpture different type of the burrs, I use these different type of the burr. These are the different type of the burr. So this is the conical burr, this is the cutting burr, this is the cylindrical burr. So these different type of the burr we usually use in the simple marathon drill, for when you have a patient have a big bump, or sometimes definitely you can use, suppose your patient have a thick lateral nasal wall, and you realize that it's very difficult to make the lateral osteotomy. So then first you drill by this instrument, and then you can use the lateral osteotomy, and sometimes it's very difficult to rasp the bump by this rasp. So then you can use this powered burr just by the simple marathon burr, and when you doing this rasping by the burr, then you need this instrument. So this is the suction and elevator also. We have a slot on this just terminal part of this one. So the entire the bone, because it's the quite big, so entire the bone dust and simultaneous is lift up also. Otherwise it's very difficult, the bone dust is collect there. So this is the this instrument by the I think the Dr. Abdul Goksel. So Goksel invention this one, and you can find I think the Marina Medical, by the Marina Medical you can find. So this is the Goksel periosteum elevator, suction with the periosteum elevator. So these are the different instruments that usually we use, and I think we have this is different type of the different type the tips for the Piaggio. When you use the Piaggio, then different types of the these Piaggio tips we use for the like the for the lateral osteotomy, for making a hole in the bone, for fixation of the both sides of the lateral nasal wall, for the lateral medial osteotomy, for the rasping, and then for this is for the rasping. So we use these different type of the tips. The problem in the Piaggio, because it will take a lot of time. So in Indian scenario we have already have too much bump, then I think this is the good instrument, the burr is the good instrument. And this is the Linderman burr, again this is the Linderman burr. If you have a good prominent antenasal spine, and if you want to fix your caudal part of the septum with the anterior nasal spine, then you just make a hole by this Linderman burr, and then you fix by the 4O PDS suture. So I think these different type of the instruments. So the important message to my beginner friends, then first you categorize your instrument, one is the basic and then advanced. There is no need to purchase the entire instrument because the instruments are too costly. So first you purchase the basic instrument. Number one, your osteotomes. These two osteotomes you purchase right side and the left side. Right side and left side, these two osteotome you purchase for the both side. This is the curved one is good. This is the basic and again this is the basic, because if you learn your osteotomy, lateral osteotomy by your teacher or by your professor by the external route, then you can, but you have both these, okay. And another, this is the basic instrument for the rest, and you need this instrument of its retractor, and you purchase the forceps, cartilage holding forceps, good scissors and the elevators and the these retractors. So and these are the again the basic instrument for the rib harvesting. So these are the basic instruments. First you purchase the basic instrument, and always remember these are the 4O 5 OPDS suture, 6O vicryl rapid for the closing, and 5O prolene sutures for Alabase excision closing, and 4O vicryl rapid 4O vicryl suture for the quilting suture of the septum. So these are the basic that when once you start the rhinoplasty, and these profilometers, angle measurement, bone cutter, Piaggio, and once you do the more and more cases, then you can purchase. So I hope that everything you enjoy this class, and if you have the any query, definitely you can put my comment box, definitely we discuss regarding that, and if you have the any more query, then you can ask, definitely I will reply. Thank you. मुकेश बंद करो. आ नहीं रहा था वहाँ पे.